The effects of COVID-19 being felt by so many Canadians, and for many, anxiety and depression continue to be issues that are tough to overcome. However, when a job or income is at risk, it's imperative that people know how to deal with their disability and get insurance for mental health claims to ensure they are properly compensated. Nainesh Kotak from Kotak Law joins us to talk about this increasing demand. I'm sure you're seeing a spike at your firm.
Yes, thank you, Bob. We absolutely have. I would say going through the summer now into the fall as we get to the winter, we've seen at least a 50% increase in denied mental health claims. You know, there was a recent article in the Washington Post where they said, look, we have two pandemics. One, obviously, COVID. The other is the pandemic of depression, anxiety, and grief. And what we're seeing, in fact, is that many people who've had pre-existing mental health challenges, such as depression, OCD, or anxiety, panic disorders, are in fact more severely affected by the social isolation for the pandemic, in addition to the fear of actually contracting COVID. And many have made disability claims, and those claims have been denied. The difficulty with mental health claims with disability insurers is simply that, you know, they're invisible. It's not something where you have a physical objective injury that you could see by way of an X-ray or an MRI.
Very much a gray area.
Very much so, and more readily denied because, you know, it's very easy to say that there's insufficient medical evidence with these claims. And I think, Bob, we're going to see many more claims in the next couple of years for mental health related issues.
What is the percentage right now? You said you have a 50% bump
Yes.
in inquiries or you know, with your firm, but how many of disability claims, how much of a percentage does this make up?
You know, I would say a large portion. Obviously, yeah. We don't see the claims that are approved. We see claims that are denied. But given the jump and given that they primarily are mental health in nature, I think it's not too difficult to extrapolate and see that there have been many more claims, in fact, and claims that they're denied. You know, CAMH had a study, Bob, that 1 in 5 Canadians has actually sought mental health help for pandemic-related fears. This shows you how this has affected our society, in fact.
So what are the reasons that insurers are using to deny these claims?
Right. So the catch-all phrase that you see in almost every decision is that there's insufficient medical evidence. So despite the fact that someone may have a treating doctor or a psychiatrist that says, look, they have these symptoms, they have depression, anxiety, what I see in the decisions as well, these are all based on your subjective complaints. In other words, what you've told your doctor, but you know, there's nothing objective about it. And then that's a fallacy, that's false, because the reality is a psychiatric diagnosis, psychological diagnosis, is based on the patient's rapport with the doctor, is based on the reported symptoms. So it really puts those, obviously, with mental health challenges in a bind. They're in a corner. And how do I prove my
Someone
case?
starting out, do they go to their GP or do they need a specialist here for their claim?
Right. You know, often people will use their GPs because it does take a lot of time to see a specialist. You know, pre-COVID, you're looking at 6 months to a year to see a psychiatrist. I think it's gotten a lot worse now because many specialists are, you know, they're not seeing as many patients and it's virtual, and there are more delays than you had before. So the initial claims, you know, you usually see it's with the GP, the primary care physician who initially prescribes medication. Sometimes employers have what's called an EAP, or the assistance through social workers.
Right.
for
Speaking
employees.
of employers, before we run out of time, I'm sure many cases are rooted in a toxic situation at the workplace, but it legitimately causes anxiety and depression. But do you find insurance companies are throwing it back at the company and calling it an HR issue?
Yes, absolutely. What they in fact say is a workplace issue, and you shouldn't be applying to us. Well, it's completely off. You know, reality is most people who are making these claims have had some history of depression or anxiety in the past, some trauma, maybe from childhood, and then the workplace experience, the toxic environment, triggers it off. And WSIB hardly ever accepts these claims. You know, if it's stress at work, they tend to reject most of them, or in fact, not, I would say all of them. So I see that a lot. And what we do, we put it right back to the insurer. Like, no, because you know what happens? The person's no longer working, for example, they're off, and they're still depressed. They're still anxious. So obviously it goes beyond the workplace. And maybe the workplace incidents over time, the toxic nature, has left a profound and lasting effect on the individual, so that it makes it extremely difficult to even work at another place of employment.
Well, it's an important area, and people have many questions. We'll link your socials and website at chh.com at Kotak Law for more information. Nainesh, thanks for joining us this morning.
Much appreciated. Thank you.